As we continue to learn more and more about COVID-19 and maybe some of the lasting effects that it has on our body, I think there are still a lot of questions. And thankfully, there are some great people right here in the Bay Area that are also looking into that. And this morning, I am so happy to welcome to this show Dr. Gooch, Chair of USF Neurology. They have a great partnership with TGH. He's the VP of Research at TGH. And again, I think there's a lot of questions that maybe we're just now starting to maybe get some of those answers. And that's why, Doctor, we're just so happy that you can join us this morning and share a little bit about what we're learning these days as we kind of enter the end of 2020 with this.
Thank you, Carly. It's a pleasure to be here.
So this partnership, and again, you were just real proud of this partnership, and I just know there's so much work and there's still so much still, I think, to be found out about COVID. But what do you, as we kind of sit here this morning, what are we talking about here? What do you think the main things are that you want people to understand when it comes what you guys are calling COVID long haulers?
Yes, indeed. Well, this is a new phenomenon that we're recognizing in patients who have had COVID infection, and these really are chronic symptoms that patients may experience after initial COVID infection, and many of them are neurological symptoms. So I'm a neurologist and very interested in this, of course, and it seems as though that COVID is actually causing brain injury in many patients, and that brain injury may be persistent for some period of time after initial infection. There are a number of ways that COVID can damage the brain. In severely affected patients, and now we're talking primarily about hospitalized patients. This is due to a number of different causes. Principally, though, it's a lack of oxygen to the brain. COVID causes pneumonia, an infection of the lungs, which, of course, the lungs serve to provide oxygen to the body, and a lack of oxygen can damage many organs, but the brain is exquisitely sensitive to oxygen deprivation. And the degree of brain injury you might experience when your oxygen levels drop really depends on how bad the drop is and how long it goes on for. COVID's also causing some very unusual things, especially in severely affected patients. It can cause this rare clotting disorder known as DIC, which is otherwise uncommon, but is being seen now to at least some degree in the majority of patients who are hospitalized with COVID. What it causes is the blood to clot abnormally. So blood clots can form in blood vessels, cutting off blood flow to many organs, including the brain. When blood flow is cut off to the brain from a clot, we generally refer to that as a stroke. And in fact, up to 1 out of 20 COVID patients who are hospitalized will experience a stroke. We're using blood thinners now and having some success in lowering that number, but it still is a risk. We can't stop it every time.
So that's what I was going to ask was treatment as we get more and more further along and figuring out, okay, what does it look like, 4 or 5 months after you're diagnosed? Are treatments catching up with that as well? Are we getting better at figuring out?
We are. And this was one of those things where this was thrown out at us out of the blue. We had no idea. It was a brand new bug. We really had no idea how it was going to behave. And we were learning on the fly in the early days, especially. We've come a long way in the medical management of COVID since that time. And the mortality rates in the hospital, especially in the United States and the Western world, I think, where we have, more advanced medicine, generally speaking, have really begun to come down, although it still is a major threat to patients who are, especially patients who are over the age of 60 years old. So our treatments are advancing, but it still remains a threat.
Yeah. What else do you want patients to know, again, as we kind of enter this new kind of phase of this, where we're seeing, what happens a couple months after diagnosis?
Well, I do want to talk about a little bit more detail about the long haulers that you mentioned, because, it's not surprising that patients who were on the ventilator in the hospital and had a really hard time might have persistent symptoms. That's kind of expected. But what is surprising is that many of these COVID long haulers are patients who had mild disease. And many of them are also young people who tend to think, I believe, that they're immune to the negative effects of COVID, but not all of them are. And when we look at the numbers, up to 20% of patients with COVID may have some persistent symptoms, and these can range from mild to severe. What are we talking about here? Well, we're talking about fatigue and body aches, dizziness. But in terms of your thinking, your cognition, we're talking about a few very important things, and that is moderate to severe concentration and memory problems, difficulties performing mental tasks, and visual spatial problems, meaning that you may have trouble navigating your computer screen or your smartphone, very important in our day and age. And these symptoms can be severe enough to be disabling, and some of these people have lost their jobs and can no longer perform their job functions because of these symptoms. So that's very important to recognize. I think the other thing to realize is that, as we talked about before, this is a new infection. We continue to learn about it, and we really don't know what the long-term prognosis of these COVID long haulers is. So far, some patients have had symptoms for more than 6 months. Is it going to go on for 12 months, a year, 2 years, many years? We don't know. We simply don't know. There's not been enough time to study it. So I think the most important thing really is for viewers to learn how to protect themselves. And the good news is that we actually have within our hands right now the means to protect ourselves. It's not that hard. Doesn't mean you have to stay locked up in your house all the time. I know everybody's sick of having to stay at home, but it does mean that you have to do what you've been hearing about all along. That is to say, wear a mask, social distance, wash your hands. Projections and studies that we've done have shown that if everybody did this universally across the board, we could reduce infection rates right now by 90%. Yeah. So these are very effective means. There was good news, of course, about the Pfizer vaccine. We could talk more about it if you'd like. But that
we're out of time today. That just means you're going to have to come back, Doctor. Okay. But I just can't thank you enough for everything that you and your team are doing, and the partnership that that's going on right now to really help us get answers. And again, we all want our families to stay safe, so we really do appreciate the hard work that you're doing. Thanks for sharing some of that research with us. There's the website, and if people have more questions, certainly they can go there as well. But Doctor, thank you so much.
Absolutely. Thank you for having me.